Should I expect mobility limitations after an osteoporosis spinal fracture? Experiencing a spinal fracture caused by osteoporosis can be a challenging event, and many wonder how it might affect their ability to move. The truth is, mobility limitations are quite common after such fractures, but how much they impact you depends on several factors. Usually, osteoporosis leads to compression fractures, where weakened vertebrae collapse or crack. These fractures often cause sudden back pain and can change your posture, which may limit your movement temporarily. Right after a fracture, most patients feel intense pain and need to rest to prevent further injury. To help stabilize the spine and reduce pressure on the fractured vertebra, doctors often recommend wearing a brace. Wearing a brace temporarily restricts movement to allow healing. Healing typically takes about 3 months, during which your mobility might be reduced to protect the spine. This period is essential for recovery, but it can be frustrating if you are eager to return to normal activities. Once the initial healing phase is over, physical therapy becomes a key part of rehabilitation. The goal is to reduce pain, restore as much mobility as possible, and help you regain strength. Physical therapy usually begins around 5 to 6 weeks after bracing starts. It focuses on strengthening back muscles, improving posture, and gradually increasing movement. However, some individuals may experience stiffness or limited range of motion for months or even longer, especially if the injury was severe. In cases where multiple or severe compression fractures occur, the spine can develop a forward curve called kyphosis. This deformity can make everyday tasks more difficult and may affect your overall posture and mobility permanently. Severe deformities can sometimes compress internal organs, leading to breathing or digestion issues, which can further impact your quality of life. Long-term effects of spinal fractures from osteoporosis can include ongoing back pain, loss of height, and persistent mobility challenges. While many people recover well with conservative treatments like rest, bracing, and physical therapy, some may need minimally invasive procedures or surgery if the fracture is complicated or if deformities develop. Because osteoporosis raises the risk of future fractures, ongoing management of bone health is vital. Engaging in gentle weight-bearing exercises, such as walking or swimming, can help maintain bone strength and support mobility. In summary, some degree of mobility limitation is common after an osteoporosis-related spinal fracture, especially in the early months. With proper treatment, rehabilitation, and ongoing osteoporosis management, many individuals regain much of their mobility. However, permanent changes in posture or function can happen, particularly with multiple or severe fractures. Always consult with healthcare professionals for personalized advice, and remember that each person's recovery journey is unique.